it sounds.
Hey there, Timeout for Moms and Moms in Timeout. I'm here today with Dr. Jordan Leasure. She is a visionary founder of Leasure Life, love that name, a virtual wellness firm dedicated to addressing the unique health needs of high achieving, stressed out women seeking more balanced and vibrant life. With a deep understanding in modern women's challenges, Dr. Leasure empowers her clients to break free from burnout and embrace sustainable wellness through holistic functional medicine approach. As a mother of two young boys, Dr. Leasure knows firsthand the demands of balancing a busy career with family life. Her experience as a parent just enriches her perspective, allowing her to connect authentically with other women navigating these same paths. Thank you so much for joining us today. I'm
Thank you
so
for having
excited
me.
to dive in. And you have a whole other, you have multiple degrees, you've been in different spaces. You've been where you are now, the founder of physician of North Shore Proactive Health outside Chicago for 18 years. So
I
how
thought
did
I'd be retired, honestly.
you're like, how did you get to where you are now? What led you to this point of like this holistic functional approach?
I think from a very early age, I was interested in medicine, or I thought I was interested in medicine. I thought when I was little, I wanted to be a doctor. And the more I learned about the difference between actual health and what behaviors lead you down the road of health versus allopathic medicine, especially in the United States, is very disease based. And so
Mhm.
that was not my passion. I was not interested in surgery. I was not interested in as funny as it sounds, I wanted to be a doctor, but I didn't want to work with sick people.
Mhm.
I was drawn to vibrancy and I was drawn to health and joy. And so the more I learned, I went down a path of chiropractic, and that's what my degree is in. My bachelor's in business was also intentional because I
Mhm.
knew I wanted to treat people the way that I wanted to be treated. And that's what all of our businesses essentially are designed with me as the target market, right? Like, what would I do to be healthy? What have I done? What do people like me do? And so I studied business, and then I got my doctorate in chiropractic. And then all of my continuing ed over literally the past 20 years has been on a wellness focus. I'm a certified wellness practitioner. I am certified in functional medicine. I have an insane number of functional medicine credentials because that's really how you keep people healthy and get them there on that journey.
So for people that are listening, I'm very familiar with functional medicine. That's like where my passion lies and the holistic approach to things. Can you define for our listeners what is functional medicine?
Totally. So scientifically, functional medicine is a systems biology approach to healthcare. Now, what does that mean in everyday English? Literally, we're looking at the functioning of the body, the functioning of the cells. So we look at, from as a functional medicine provider, we look at the root cause of disease. So if I'm seeing a woman for a thyroid disorder, if she has been diagnosed, let's say, with Hashimoto's, and her doctor's toolbox is going to be drugs and surgery. If she has a really awesome allopathic physician, they've discussed diet, not a lot do. On the flip side of that, when they come to me as a functional medicine provider, we say, why do you have Hashimoto's? Why is your body expressing this disease? And we dig deep. Usually there's a gut component. So we're going to do some testing and see, does she have an H. pylori infection? Does she have a bacterial overgrowth? Does she have candida in her system? And her body's using all its energy to fight said infection or disease process, and there's not energy left to heal the thyroid. So the body is diagnosed with a thyroid condition. But really, if we solve the root cause, that resolves itself.
And I love that because it's not just fixing it when it's broken or
Mhm.
I shouldn't even say fixing it, masking it with drugs when it's broken, looking at like why it's happening. And then of course, preventing what things can come after this.
Totally.
If you have the thyroid condition, there's a lot of things that go along with it that once you
Exactly.
start on the medicine and continue down that path. So
Yeah,
you
we look at everything, and our end goal, as funny as it sounds, is longevity and helping our clients exude health ongoing, right? You know, similar to what you do with your clients. There's not really, it's not like you see a doctor, you know, you take a prescription for 7 to 10 days and you're done, right? If you're working with someone like us, and I'm including you in the us, proverbial us, um, you have the honor of continuing on that journey with people
Mhm.
so that you're optimizing their health and sort of being there, um, helping them navigate the lifestyle.
Absolutely. Like I tell people, there is no finish line. And
Mhm.
people, a lot of, especially women, think if I just hit this weight, then I'm done. And there's the finish line. There's like your health and wellness, there's never a finish line. Everything
Right.
is constantly changing and shifting. And as we age, even more so. And that we just keep moving the finish line. We keep moving the goal. And yeah, the beauty of it is that you can continue to serve people just in a different way. If
Mhm.
they get better, great. There's always going to be some other area that we can improve.
Well, and unfortunately, you know, in today's, again, I don't know if all of your listeners are local to United States, but you know, we unfortunately live in a very toxic society.
Mhm.
So as much as we try to do, or as much as we have to do for a lot of our clients, that is like catch up, right? We're healing, we're detoxing, and like you said, we hit that one goal, or maybe we eliminate or exterminate the infection. You need to be proactive literally every single day,
Mhm.
because society is so toxic, right? Like our water is so toxic, our air is toxic, and I don't mean to be like a Debbie Downer. Our products are toxic, right? And even the quality of our food. Even if you're eating organic, like an organic carrot, for instance, has like 80% the vitamin C that it used to have like 30 years ago. So
Mhm.
you need to be very deliberate in what you're eating, how you're eating, your emotional health, all of it. It's literally, it's a job. It's an ongoing process.
Yeah, and every choice you make contributes or takes away from that job that your
Mhm.
one machine that you have is doing. So can you walk us through like when someone comes to you, what does it start with? How do you assess this? What does it look like day one? They come see you,
Sure.
they're like, I'm obviously there's usually probably a problem. They've or they're struggling to get a doctor to listen to their signs and symptoms. That's how a lot of people end up in a functional space of like,
Yes.
I'm just not getting answers. So what does day one look like?
There's a lot of frustration.
Mhm,
We always offer complimentary consultations because our programs, you know, similar to what you do, right? Like lifestyle is not a quick fix. So I
mhm,
always want to make sure that if somebody wants to work with me, it's because it's me, right? Like I'm the right fix. And I'm an acquired taste for some people. And I'm a very high D on a disc profile. I'm very direct, but I've been sort of uh likened to, let's say, I was gonna say a gummy bear, but that's not right. What are the ones that are like, salty on the outside?
Sour Patch Kid?
Yeah, like a Sour Patch Kid, right? Like I'm salty on the outside, but I'm very, very sweet on the inside, and I am. I'm probably the most empathetic person in the world, but because I have that high D personality, I give it to people straight, and sometimes that's a hard pill to swallow. But, you know, after we do a consultation and someone decides they want to work with us, whether they're in one of our group programs or they're doing one-on-one work, our one-on-one programs start literally with a 75-minute doctor visit.
Mhm,
And I've had some clients and they're like, "Oh my gosh, I've never had somebody listen." Right? Like most doctors, they come in, they look at your symptoms. I've had patients that have never been touched, even in orthopedic practice. And I'm like, well, how did they come up with a diagnosis if they didn't move your joints, if they didn't ask you questions? And unfortunately, in today's healthcare, the average doctor visit is 6 to 8 minutes. And that's a very, very short period of time to listen authentically to what someone's concerns are, to possibly review lab work, again, to lay your hands on someone, you know, even taking a temperature or taking a blood pressure is a very rushed experience for a lot of people. So
mhm.
for us, all of our functional medicine services are virtual. So I get the opportunity to sit down and literally talk and take a history on a client from conception to current. So I'm looking at, you know, what were your parents' health like when you were conceived? And there aren't a lot of doctors that ask that question or even think that that's important information. But for us, it lays the foundation of someone's health. I'm dealing with women in their 40s, and what was their dad's health like when they were conceived is mind blowing.
Yeah.
Mhm.
And that's, I mean, just to have that foundation and to have that history, and you're right, to have someone listen,
Mm.
6 to 8 minutes. I mean, what can you get through in 6 to 8 minutes?
Nothing, literally.
How fast can one talk in 6 to 8 minutes? I mean, that's pretty crazy. So then you have that consultation with them. You get that, you kind of lay the groundwork for what could potentially be going on, or at least the
Mhm.
history of what, and I'm guessing like what it comes up to now, like what's their current
Yes,
kind of complaints and theories on what things are going on. And
yes.
then what? Blood work?
It depends, right? So in a functional medicine practice, blood work is very standard blood work, let's say, is very basic.
Yeah.
Now, we do a lot for our clients. We run a report. It's called an optimal blood chemistry report. It's like a 50-page report
Mhm.
on standard blood labs, right? But we're looking at it through a different lens. So we're able to be predictive on your health. So instead of saying, like, okay, hey, your TSH, which is usually the only thyroid test that women are receiving, you can't judge a lot of thyroid health from that one lab. So for us, we recommend a 7-point thyroid test. So we're looking at 7 different markers. And then we're able to say, like, hey, you're not, maybe you're symptomatic, you're not diagnostic yet, but you are trending in a direction that makes us uncomfortable. So we're going to implement some wellness tools.
Mhm.
Now from a functional medicine perspective, the testing is very different. So I tell patients, and as crude as this sounds, we can test every fluid that comes out of your body. So we do a lot of testing on gut health through stool, and all of these kits are completed at home. You're not doing this, out at a lab, but you're completing it in the comfort of your own home. We're testing stool, we're testing urine, we're testing saliva, a SIBO gut test, which tests for a small intestinal bacterial overgrowth, is actually air. So you're actually blowing into little vials and you send that off to the lab and they test that. So functional medicine testing is pretty fun in that we're looking at things that are not, everyday blood markers.
Mhm. And one thing we talked about when we first chatted was like a normal range. So I know,
Yes.
like the woman you were describing, the thyroid person sitting in front of you, for years they said, your thyroid's a normal range. Your thyroid's a normal range. There's nothing wrong with your thyroid. And it wasn't until I got a different OBGYN when we were trying to get pregnant. And he was like, I want you to go to an endocrinologist and really take a deep dive into your thyroid because there's nothing else that's coming up that's even potentially close to being appearing wrong or off or not normal. So talk a little bit about these markers because when I learned this, my mind was blown,
Yes.
and I talk about it all the time with women now.
Yes, this is one of my favorite topics. So, what I hear from a lot of clients is, and pardon my French, I feel like shit, but my doctor says my labs are fine.
Exactly.
And it's kind of funny until it's you in that position, right? And a lot of us can relate to that. Like what could possibly be going wrong? You start to think you're crazy. I've had doctors recommend anti-anxiety meds to patients because they're so sure something's wrong. And they are, right? Like we're very intuitive women. So we know things just aren't right, or I don't feel as good as I want to. Now, standard labs, if you go to Quest, LabCorp, whatever it is, and you get that report from your doctor, lab values, and this is going to blow your mind, so sit down. Lab values are not universal. So lab values are unique to the lab where your blood is drawn. And if you take a minute to like extrapolate on that even further, who goes and gets their blood run most often or gets repeated blood work done? Sick people. So people that are going to have surgery, people that have chronic illnesses, people that are actively working on improving their health, hopefully, are the ones that are getting their blood work done most often, right? Healthy people are not as often, maybe even as they should, getting labs done. So the labs are taking an average of the people that are getting their labs drawn, and that's how they create these like benchmarks, right? So if you're falling off the end of lab range, that's where they diagnose you as, diabetic or getting hypothyroid or you have high cholesterol, whatever it might be. Now, functional medicine physicians, we use what's called optimal values. So, what does it look like to be in optimal health or to be in optimal functioning, right? And those values are universal. And those benchmarks, those like high and low values are set, they are solid. So, if you fall within that range, you're going to be considered optimal, right? That's where we want to be. And then we also look at like low and high, like slightly low, slightly high. And then we start getting in that lab range. So optimal values are much tighter, is a probably easier way to think about it. So if you are looking at your lab work and your doctor says you're fine, okay, all that means is that you haven't fallen off the cliff yet. That doesn't mean that you're healthy. That doesn't mean that you're optimal. And you can probably intuitively know you don't feel as good as you want to be feeling.
I think that like intuitiveness part that you touched on is like, and obviously I can only speak from being a woman. I've only ever
Mhm.
been a woman, but having that gut feeling of there is something wrong, it's like you do know. Like
Mhm.
it's amazing to me when people go in and then I recommend to go see a functional medicine specialist. And it's like, yeah, you could be quote normal, but if you really feel that there's something going on, there probably is something going on. Or your, like you said, optimal number is not in the like it falls in the range
Right.
of that normal. And for me, like the TSH example that you gave, it was like, yeah, my thing was normal, but in order to conceive, my numbers were off the charts like
Yeah.
after looking at the function from a functional standpoint. So that part always blows my mind, and I love hearing experts talk about it because it really, when I learned that, I was like, what, well, why is it like that? I was
It's
confused. I was
it's
like,
horrible.
what do you mean this is, and then I was like, I was just thinking thyroid, but then you look at everything else and then it's like that. And you're like, well, what is the right one for me? Like,
Mhm.
where should I fall on all of these things when you look at a lab report? And that's where I think that's where functional medicine comes in. That's where you can get your answers of the optimal range for you.
Exactly.
And if you're still feeling off, you'll take a deeper dive and look at other things where you could be slightly outside, because slightly outside for you might be very outside your optimal.
100%. Yeah. And most of us, I think, don't realize because unfortunately, and again, I sound like a Debbie Downer when I say this, but on average, right, and depending on where you live, but on average, everyone's health is not as good as it could or should be. So if you're
Mhm.
comparing yourself to your neighbors, if you're comparing yourself to your friends, right? And we're all moms and we're all tired and we've all got the weight to lose and we're all agitated and we're all irritated. Like just because it's common doesn't
Yeah.
make it normal, right? And like, why should we all feel like crap? That's sort of my goal here is
Yeah.
to educate and empower women that you could be doing better, you could be feeling better than you are right now. There's options.
So what should be their first step? Like if someone's listening to this and they're like, you know what? Like I'm sick of feeling sick and tired.
Yeah.
That's what I hear almost every single day. What's the first step? And let's say they have gone to their doctor and they're like, nothing's wrong. Like this is just, I hear it a lot, like being the age I am in my mid 40s and being like, well, perimenopause, this is just a part of aging. So speak on that a little bit. What's the next step for them? Should they
Sure.
just sit back and live with it? Like a lot of people are
No,
told. Absolutely not.
No, I think it depends on where they are in their health journey, right? I think the first step is this, right? It's education, it's awareness, it's empowerment, it's feeling hopeful that you
Mhm.
can feel better, right? And same thing, right? Like I'm in my mid 40s, my later to mid 40s. And similar like you and I talked, I had my kids at 38 and 43, natural, no interventions. I just say, the times I didn't try to not get pregnant, I got pregnant. And, I hear about hair loss a lot,
Mhm.
and how it's just normal. Okay, well, I'm 2 years postpartum and allegedly, perimenopausal in my mid 40s, and like my hair's
Mhm.
fine. So
Yeah.
it doesn't have to be, this struggle that all of us think that it is. If you're
Mhm.
ready to, dive further definitely standing up for yourself at your doctor's visits. And if you aren't feeling good, saying why,
Mhm.
remembering that your doctor works for you, right? You're the one paying the bill. So if you're not getting the answers that you want, it's okay to fire your doctor. And you don't have to say that. You'd have to be confrontational. But it's okay to look for a different physician, to look for someone that's going to respect your wishes, to be on that journey with you, to dive deeper.
Mhm.
We could do an entire segment on insurance and having to pay for healthcare, which we do, right? That's one of the biggest complaints I hear in the northern Chicagoland area. People have great insurance. They pay a lot for great insurance, but on
Mhm.
the functional medicine standpoint, a lot of it's not covered because there's not an insurance code for me to spend an hour and a half with a patient. I can't take that 8-minute code and multiply it by 10 and get reimbursed for my
Yeah.
time. It just doesn't work like that. So, coming to the realization that, yeah, you're going to have to pay for, maintaining yourself, right? It's sort of like when you do maintenance on your car or maintenance on your home.
Mhm.
Insurance doesn't cover oil changes. Insurance doesn't cover gas. Insurance doesn't cover a gorgeous brand new kitchen. And you think of the lifetime you're going to spend in the home or the amount of years you're going to spend in the home versus like you as a being, you're stuck with this. So you better, maintain it. You better put the money in. You
Mhm.
better be ready to make an investment because this is going to serve you, very well if you do.
Like you
For
said,
us,
it's an investment now. It's an investment now to save God only knows how much money later. And that's
oh,
why I talk to people
100%.
about their wellness journey in general. Like eating healthy now, yes, it might cost a little bit more now, but what are we avoiding down the road? Exercising now versus down the road. So yeah, an investment in yourself for sure. And we do it easily with home improvement. Why not
Hmm.
improve this home?
Right. Yeah, and it's a game like anybody else, right? Like I'm not a big, unlike a lot of women, like I'm not a big shopper. I'm not a big shoe person. I
Mhm.
love buckle jeans and I'll wear the same 2 or 3 buckle jeans like for years. That's like my wardrobe.
Yeah.
But I eat all organic, I get adjusted, I get massages, I get acupuncture every single week, I get facials, I have a gym membership and a Peloton. My investment, my money is spent on myself,
Mhm.
on stress relief and things like that, as opposed to on, the who's coffee
Yeah.
and things
And
like
just the
that.
material things in general
Mhm.
that will come and go,
Right.
that will sit in a closet, that will eventually
Exactly.
be donated kind of
Right.
thing. Mhm.
Yeah, I think it's definitely choosing, and our clients, some of them are ready to invest. I mean, the programs that we run, our most popular program is 4 months, and that
Mhm.
allows us to get people started and really figure out what's going on with them. The Hormone Harmony program that you and I discussed, the
Mhm.
group program is 90 days, and that's a
Mhm.
really awesome way for women to learn about themselves and implement and change. So it just kind of depends on, where people are in their journey to get started and how ready they are to feel better.
Absolutely. And I guess that's what it is. It's how ready are you for a change and
Mhm.
where to start. So where can people reach out to you if they have questions or if they're ready to learn more about your programming? Where's the best place to reach you?
Totally. So, leisure-life.com is our functional medicine portal. That's our functional medicine website. Reaching out to me directly at our office at info@drleasure.com, and that's
Mhm.
DRLEASURE.com. And I always spell it for people because I don't know if it is anymore, but 20 years ago when I started, Dr.
Mhm.
Leisure, as in fun,
Mhm.
.com was a nude beach. So I like to make sure that I'm
Fantastic.
very
Good
explicit on
distinction.
where to find me.
Nude Beach, North Chicago. That's gonna be an interesting one.
You never know.
You never know. Well, that's fantastic. I'm gonna put your links in the show notes for this so people can find you. And thank you so much. Just a wealth of information. I look forward to
Thank
continuing
you.
these conversations and
It's so
just
fun.
learning more because there's always more to learn. And then as we change and grow, there's even more to learn. And
Exactly.
perimenopause, that's a real thing over here. Don't let
Mhm.
anyone else tell you differently. Thank you so much, Dr. Jordan. I appreciate you.
I love it, Sarah. Thanks for the time.
Of course. We'll chat soon.
That was good.
Take care.
Bye-bye.
Bye.